And here is your question. Right, so if you have read and understood, considering it communication skill station, kindly please begin.
Hello, I am Dr. Ahmed Alay, Senior House Officer working in the Royal Hospital. I am calling to speak to and confirm about post-operative day 2 lady who underwent mastectomy with axillary clearance. May I confirm that I am talking?
Yes, I'm the consultant. Summarize your case.
Good.
Yes, we have this lady who underwent mastectomy with axillary clearance 2 days ago. The patient developed after that wound swelling and hematoma, and I think the drain also drains some pure blood. The patient has background of left ventricular failure and also COPD. Her daughter wanted to take her today to her house, which away from the hospital. I spent around 20 minutes convincing her to stay in the hospital until she is medically well and we can charge her medically, but she insists she took her mother and go away.
So the patient made her own decision or her daughter made her do this decision?
I think the daughter insists and convinced her mother to take her with in her house. Our patient wants to stay in the hospital and to ensure that she's ready to go to her house after she become well.
Is the patient alert and capable of making her own decisions?
Yes, the patient has competency to take her own decision. She is alert.
What do you think is the cause of the swelling in the axilla?
Regarding the time after surgery, it may be reactional hemorrhage.
What is the reactionary hemorrhage?
It's a primary hemorrhage after the operation. Maybe they slipped some clips of arteries.
And about said she have dyspnea, right?
Yes, and she have developed with this swelling some dyspnea. Regarding her background of COPD, maybe the cause, and her heart problem, maybe the cause of dyspnea, or this swelling may increase also our attention to pulmonary embolism, and post-operative pain also may be one of the causes.
So what would be your plan, action for these complications?
First, for this hemorrhage, we will draw some labs and follow regularly the hemoglobin of the patient and cross-matching for any blood possibility of blood transfusion. And if with hematoma in the wound, for sure we prepare here for wound evacuation, and we can go for CT angio for exclusion pulmonary embolism, and Doppler for her veins to exclude DVT.
So do you think it would be safe for her to go home?
No, with this new complaints appeared on the patient as is shortened breathing, and the wound is not the best condition to go to her home.
But if she insisted, what you will do?
I will inform her, the daughter and the mother, how to deal with the drain, and for sure they should consent a legal document insisting that they are discharged at home without against medical advice, and let him know well about any complications that happen, and they take responsibility for all adverse outcomes that may appear, and learn him very well what is the sign and symptoms they should keep their eyes on it, like feeling of unwell, increasing the charge from the wound, increasing shortening of breathing, her general condition is not improved. All this is red flags, signs they should solve the advice very rapidly.
Okay, and when you think she should remove the drain?
The now drain is drain pure blood, so I will check the amount and get back with the result. When when the drain is less than 50 milli, and when it stopped, we can arrange for a nurse, community nurse, to go their home and remove it, or can arrange where GB can see here and follow the drain matter.
Okay, I think you can tell the patient about discharging against medical advice.
Okay.
You still have 2 minutes.
Should I summarize the case?
You should talk about the
Okay.
warning signs and symptoms that you've told the patient.
Yeah.
Okay. Regarding the signs and symptoms, we should insist that the patient keep eyes on that. Regarding that, she may develop increasing her chest, shortening of breathing that improve with the regular medications they took. Any new of chest pain or tightness, any feeling of disturbed of their consciousness, decreasing their concentration, inability to dealing with her daily activity, and feeling indigenous, all that is feeling unwell in general. This is red flags, sign and symptom that needs the patient to go and sought medical advice. And also regarding the wound, she if there is any more obvious bloody discharge from the wound, any discoloration around the wound, any abnormal serous or yellowish or greenish discharge from the wound, any signs of redness or more pain increasing in the around the side of the wound. All this is local signs, so they keep looking for and keening about these signs.
So if the patient developed the SOP from the DVT, how you would manage this?
Develop the what?
I mean, if she have a pulmonary embolism.
Oh, if it is for sure, the patient should be admitted and kept in a high dependence unit, and for sure we cooperate with the intensive service, intensive care unit or intensive therapy unit. And after that, if the patient is stable, we can get the patient with unfractionated heparin around induction with 80 international unit per kg, and go after that for the maintenance with 15 or 18 international unit with per kg. If the patient is unstable, we can go for embolectomy or thrombolysis.
You'll
Before
involve
that, we do
medical registrar as well. You'll not be doing all this yourself. You'll involve medical registrar, and then you'll manage the patient.
Okay.
In this one, very important.
Yes.
And the investigations that you had to do.
Yes, we should go for CT angiogram, and also some labs like D-timer and fibrin degradation product.
Yes, and the basic chest X-ray.
Yes, for the basic chest X-ray and ECG.
Yes, and once you're sending the patient home, you will also refer or you'll contact the physiotherapist so that A physiotherapist can also go home and help the patient.
Yes, it's important point.
Good. Good. Thank you.